We have a new poll with Ipsos this morning, finding that 40% of Americans want to get the vaccine as soon as possible. 44% prefer to wait a bit. And the Surgeon General, Dr. Jerome Adams, joins us now to talk more about the vaccine. The encouraging news in that poll, Dr. Adams, thanks for joining us this morning. Only 15% of the American public right now says they don't want to get the vaccine.
Absolutely. I think it's important for people to know that vaccines are going out. They're safe and they're highly effective. And you see in the Pew poll that we went from about 30% of people who said they would get the vaccine just a few weeks ago to now 60%. That's great news on a great day, and it's balancing the really somber news that we've got still over 2,000 people dying every day from this virus. So I want people to know hope is here. Help is on the way, but we still need to remember to wear our mask, wash our hands, and watch our distances until we can all get vaccinated.
We got to do that in the meantime. And talk about the potential side effects of a vaccine and what people should be ready for when they take it, and what they should be concerned about.
Well, that is a great question, and let me give you some real practical advice. We know that we're going to first vaccinate people who are vulnerable, but for everyone else out there, you should be going right now to get your flu shot if you haven't already. And talk to your doctor about vaccinations. Get your questions answered, because it is okay. It is normal to have questions. What's not normal is to let misinformation rule you. Vaccines will sometimes give you a sore arm. They can give you a little bit of a mild fever, or you can feel a little bit bad, but that's normal. That means the vaccine is actually working. So I want people to know that, again, we've had people vaccinated for literally almost 100 years in this country, and particularly the flu vaccine. Hundreds of millions of people have been vaccinated. This COVID vaccine, I will be getting it when they tell me I can get it. That's how confident I am in its safety. And remember, 95% effectiveness means we can put this pandemic away if we get enough people vaccinated.
When do you think that will be? When will you be getting the vaccine? There's been some talk about when top administration officials should be getting it, where they should be in the line.
Well, again, we need to make sure we're immunizing for impact. That means we're immunizing the people who are most likely to be harmed, and seniors. People in nursing homes are 40% of the deaths, even though they're 0.4% of the population. So it makes sense to start with them. Our healthcare and frontline workers are going to be next. And I still practice medicine. I also travel around the country and deploy as part of my job as Surgeon General. I was in Montana just this weekend in hospitals there helping people respond to COVID. So I imagine I'll be in that first tier. But again, we want to make sure we're getting the people who are most likely to be impacted vaccinated first. We also recognize that there's a symbolic part of someone like me getting vaccinated, giving people confidence that they can get vaccinated. So again, when they tell me I can, I will, and maybe on Good Morning America with you, George.
Well, you're welcome anytime. You mentioned that Pew Research survey. It found that 60% of whites and Latinos say they're going to get the vaccine, but only 40% of blacks say they will. Well, how do you explain that, and how do you think you can change minds?
Well, we know that people of color, and particularly African Americans, have legitimate reason to be distrustful of the medical institutions and the government. When you look at the Tuskegee experiment, where, again, quite frankly, African Americans were treated very badly. So we need to acknowledge that. We need to help people understand there are protections in place now to make sure that never happens again. Independent data safety monitoring boards, independent review boards, the Office of Human Research Protections. And then we need to engage. And I'm working with the Vaccine Consultation Panel, the National Medical Association, the Rainbow Push Coalition, many other groups out there to help people understand and get their questions answered. And when you answer their questions, when you acknowledge what happened and answer their questions, more and more people will have confidence. And one more important point, George, many people haven't seen someone die of measles or die of polio. This vaccine, I think, actually can promote confidence because people are seeing the horrible impacts of a vaccine-preventable disease all around them.
No question about that. One final question. Once somebody gets the vaccine, how safe are they, and should people feel free? Are they safe to see them at any time, or do you still have to be careful?
We still need to be careful into the at least second quarter of next year, because these vaccines were tested with an outcome of severe disease, not a prevention of infection. So we don't know yet whether they will prevent infection, but they could prevent you from being in the hospital and ultimately passing from this virus. Still incredibly important to get vaccinated, but we're going to need to continue to wear our mask, wash our hands, and watch our distance as we slowly start to reopen with the assistance of these great vaccines.
General Adams, thanks for your time this morning.
Thank you.
Special edition of 2020, The Shot, the race for the vaccine, about the safety, access, and timing of the vaccine, airs tonight at 10 Eastern.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.